Challenges are what make life and profession interesting, and overcoming is what makes life meaningful. A very warm and refreshing good morning to all of you attending today's webinar. I, Professor Shweta Patnaik, Organizing Secretary of the event, welcome all of you for the 5-day Clinical Skill Development webinar. Nursing is an art, and art without skill is baseless. Due to this COVID-19 pandemic, our nursing students are devoid of clinical practices and skills. Clinical skill training sessions include the delivery of a theoretical session and the opportunity to practice and learn more. Choitram College of Nursing, in collaboration with Choitram Hospital and Research Center, is proud to hold this clinical webinar series, which is specially designed for nursing students to overcome this long disruption in skill development. Today, we are gathered here virtually to gain some more experience on clinical learning. I'm really thankful, and from the bottom of my heart, I welcome our eminent resource persons who accepted our invitation and agreed to join us. I welcome all the participants of the webinar, and I hope that you will take the maximum out of it. Now, I welcome Dr. Professor Aradhna Michael Ma'am, Principal and Organizing Chairperson of the event, who motivated us to successfully organize this series of webinar. I request Madam to address the gathering and motivate the students. Over to you, ma'am.
To this digital platform learning. The global health pandemic with COVID-19 has hugely impacted the health community, causing significant disruption to routine clinical practices as well as teaching and training. The speed and scale of viral spread have overwhelmed health services across the globe and has required diversion of all clinical resources to save lives and help and protect healthcare workers. The wide variety of webinars available online have provided a new level of convenience in medical education, where learners can engage in gaining education on a medical platform, where online availability can be incorporated easily, even within the time constraints of regular working days. Keeping in mind the nursing graduates, the webinar is planned in order to upgrade the students' clinical knowledge while they are at home. This environment provides us opportunity for nursing students to learn experimentally and to convert theoretical knowledge to a variety of mental, psychological, and psychomotor skills, which are of significance for patient care. Students' exposure and preparation to enter the clinical setting are one of the important factors affecting the quality of clinical education. I hope the students take the utmost benefit of the webinar series and try to maximize and refresh their learnings with the help of the experts. Thank you and all the best.
Thank you, ma'am. So before starting today's event, let me give you a quick review of the whole week's schedule, which will stimulate you to learn more about the clinical area. This expert speaker of the day one is Ms. Angeline Esther, from Associate Professor from College of Nursing, CMC Vellore, who would be speaking on clinical learning challenges of nursing students. Second day, we all will be hearing about nursing approach to stroke patients by Professor Elizabeth Burgess, Principal, INHS College of Nursing, Mumbai. Analyzing and interpreting lab results will be the third day topic that would be dealt by Professor Neelam Das, Mohandai Oswal College of Nursing, Ludhiana, Punjab. On fourth day, the challenges in post-operative nursing care will be discussed by Ms. Shalini Chandran, Associate Professor, College of Nursing, CMC Vellore. And on the fifth day, Professor Suman Alexander from Dashmesh College of Nursing, Faridkot, Punjab, will be speaking on emergency assessment of geriatric patients. I welcome all the speakers of the webinar once again. So this is the whole week schedule. You are requested to please take note of the timings. That is not in common actually for the for daily, right? So already it has been mentioned in your flyer. So please take note of this. Now proceeding on with our session, I feel happy to introduce our first speaker. I feel happy to introduce our speaker for today's event, Mrs. Angeline Esther, Associate Professor, College of Nursing, CMC Vellore. Madam completed BSc and MSc Nursing in Medical Surgical Nursing from CMC Vellore in 2002 and 2009 respectively. After completing her graduation, Madam worked as staff nurse and then as tutor or the charge nurse. After completion of the post-graduation, Madam continued her work as junior lecturer, then lecturer, reader, and thereafter she was promoted to the post of associate professor in 2017. She's got a vast experience of 18 years in total. And now, Madam is presently working as an associate professor in the Department of Fundamentals of Nursing at CMC Vellore itself. Madam has been resource person in many institutional, state, and few of the national workshops. And she has been a part of organizing committee for many workshops and conferences at state and national level. She's presented papers at national level, and many scientific papers have been published in different index journals as well. Today, ma'am will be taking a session on clinical learning, the challenges which the nursing students face when they go for their clinical duties. So once again, we welcome you, ma'am, and I request all the participants to put their queries in the chat box. When madam wants to discuss in between, she'll be also telling you about the same. Thank you so much once again. I hand over the session to you, madam.
Good morning, everyone. Extremely delighted to be part of this webinar series and to start the day. And actually, to be frank, I'm overwhelmed, and it's a joy because it's been 6 months. All of us have been going through a COVID period and we are not able to meet each other as students. And we have been doing only online classes. And today we are overwhelmed to see you all. And I always love to teach students. Being in fundamentals first year nursing students, it's a challenge for us actually, because the students come with a total different idea, and allowing them to enter into nursing itself is the biggest challenge for all of us. And to make them have a positive attitude towards the profession itself is a challenge. So having this challenge, and we have been doing it every day, today I'm happy to actually talk to you all about your clinical learning and challenges of nursing students. Okay, without wasting much time, I will go fastly into it so that we will have a better discussion time. Okay, so I work among first year students. I know how it feels for a student to go to the clinical area for the first day, because every year we take them. It's not only the students' heart, even the teachers' hearts keep bounding, because how this day will come to an end. And I know it's not easy for students to go into the clinical area just like that, to meet a patient who's totally new with so many challenges around them. So coming into what is clinical learning in the clinical area is basically, you all know it. I'm not going into very detail about the definitions. Whatever you learn in the classroom, either from your teachers or from the textbook, and try to apply that in the clinical setting is called as clinical learning, to make it very simple. Example, if you learn something about the normal lab values, okay, and you go to the clinical area and you find somebody's potassium value is deranged. Now you are recollecting quickly what is the normal value, whether the patient is having an imbalance or the patient is having a normal balance. That is what is clinical learning. You are able to apply whatever you learned in the classroom into the clinical area, and end of it, the patient is going to be benefited. That is what is clinical learning. But unfortunately, clinical learning is quite challenging and unpredictable. Sometimes it's quite stressful because the environment is something dynamic in nature. It's not like a classroom where inside 4 walls and you have complete account of things. Okay, things will go in the way you have planned. It's totally challenging because it is not alone your world. You are entering into patient's world and the relatives, many health disciplines. So it's something quite challenging and quite dynamic in nature. Okay, so sometimes these clinical experiences are negative. It can affect your trust, your attitude, and your student learning. And many times it also says it is a great waste of time and energy if your clinical learning is not going to be complete. And many studies reveal that though clinical training is something indispensable, but most of the students does not achieve their objective end of the clinical posting. So we are going to see now one by one what are the challenges. First, I'll just discuss with you all what are the challenges. Then we go about seeing the remedies or strategies for these clinical learning. Basically, as I told you, it is not something very created. So it is not something which is methodological. Okay, it will go along with the patient's world and other healthcare disciplines and also routines and policies of the institution. So clinical settings are usually seem to be a bit complex, but a variety of barriers are there for us students, especially to learn. So there are many studies that are done across the world, and if you look into it, whatever I'm talking is at least from 7 to 8 studies. And also this assignment made me to actually reminisce over my student period, and that made me to bring about many insights. So there are many things. Okay, it's a clinical area. It's not something like, no, it's only the student responsibility. It is a student responsibility that aligns along with the teachers. So I'm not going to concentrate much about the challenges from the teacher's point of time, organizing a good clinical environment. And today I want to highlight about what are the students' challenges, what are the inefficiencies or deficiencies from our side. So if you look into it, there are many challenges: incompetence of clinical instructors, you don't have a positive role model, not a supporting learning environment, very short duration placement, okay, unclear objectives and guidelines, lack of orientation, ineffective communication, inadequate readiness, emotional reactions. You go through a lot of emotional reactions when you go to the clinical area. Apart from that, your evaluation method, how you will be evaluated, what is your linguistic and intercultural competence, all those things plays a very major role. We'll see one by one very fast. First, the most important one is inadequate readiness. When you're not adequately ready, if you're not ready, it's very impractical for you to enter boldly into the clinical area. Basically, there are three reasons for the inadequate readiness. Number one, you lack knowledge. Number two, there is a deficient practical skills because you have not updated your skills. Number three, there is a problem with your communication. All three plays a very major role. Many times students have less amount of knowledge, so they are not confident to enter the clinical side. Here I stated where a student has told, I want to give injection pantoprazole, but I have no clue what is this medicine is all about. But so the bystander has asked the student saying that, what is the action of it? Is it an antibiotic? The student has replied, I think so. So this is one of the reason most of the time what happens is that students with inadequate knowledge, you are not comfortable to enter. Sometimes it's deficient practical skills. We all know without skills, we cannot do anything in the clinical area. I keep making fun of my students. If you don't have skills, you will kill. But certainly it is not going to happen if you're there in a supervised environment. But still, skills is something is very important, specifically basic skills. Without basic skills, you will affect the quality of care for the patients. Like here also, there was a student who told that my professor asked me to check the blood pressure for my patient, but I was so tense because I could not recognize the sound. Very recently, I went for a practical examination. It was very heartbreaking for me because I told the student, the procedure assigned to the student was blood pressure, and I told the student to check BP. And she started to shake right from top to bottom, literally shaking. And I got, what's wrong with this child? So I went and asked the student, what is that that's troubling you? She said, ma'am, I've never checked a blood pressure on a patient. This is the first time I'm checking. So sometimes deficient practical skills does not allow you to function to your fullest. Okay, so that is also. Third one is communication skill. All of us lack at some point of time. We are not able to communicate what we really want to communicate. So there was a student, this is also a scenario which was given in a qualitative study. A student walked along to the patient's bedside who had an AV fistula, arteriovenous fistula. And the patient had a big bulge in the hand, and the student, without realizing in front of the patient, asked the professor what is that bulge is all about. And the patient became quite upset and did not communicate. The student felt much regretted why she ever asked the question in front of the patient. At times we don't know what to say, where to say. That is also there. The most important barrier all of us have is language barrier. Though we know most of the communication, 55% of the communication is non-verbal, but when it comes to place when you need explanation, when you want to create trust, okay, you need language, because language is a medium for us to communicate. Here, one of the study clearly says it is not only a challenge for student, it also a challenge for the patient, because patients find it difficult to convey their needs and students find it difficult to explain the procedure to patients. And it also says that patients tend to avoid students who do not speak the same language because they have a fear whether they are being misunderstood or they'll be misdiagnosed. Okay, so this is the biggest huge problem, especially the patient is not from the local area or the student is coming and studying from elsewhere. This is a constant barrier for or a challenge for the students. Second thing is inadequate sense of humor. I really agree with it because the area itself is quite complex and so dynamic, and you are so stressed and you don't have somebody who just have a sense of humor. If things that is taught for you is not with humor, sometimes it makes you exhausted and you lack enthusiasm. But one thing I want to tell you, enthusiasm is something is very infectious. If you are enthusiastic and you have some amount of self-confidence, even that will persuade your teachers, and it's vice versa. I still remember in our first year, we went to a ward and one of my classmates who wrote, she used to write again and again a word wrong spelling, that is for vomiting. So one of my tutors, she called the student and said, however severe the vomiting is, vomiting has only one T. That is the way she corrected and still fresh in my memory. She said even the patient brings out a copious amount or just few bouts, okay, or whether the patient vomits right here or it's a projectile goes there, vomiting has only one T. I really admire the teacher, the way she corrected the student, and it's still fresh in my memory after 22 years of student period. Okay. So next is perception of intercultural competence. This is also very important when you care for patients. When you're not able to understand patients' culture and religion, you tend to have prejudices. You don't talk to them the way you're supposed to be. A patient does not talk to you. Initially, being in Tamil Nadu, when I went into the clinical area, one of the patients from another state called me a sister. Okay, that took me back, and I was taken aback because in Tamil Nadu, we don't address anybody with A. Okay, but it took time for me to understand that is his way of talking, that is his culture. Okay, sometimes we need to understand, then only smooth dialogue will take place so that what we are supposed to achieve can be achieved. And the most important barrier is theory and practice gap. I want to challenge most of you. You learn so much of theory, but only problem is we learn so much of theory in nursing that many times we don't practice it. Maybe we do it for the procedure's sake, and after that we forget to practice in our life. That makes us inadequate a bit. Okay, and many times you are being torn between the tutors and the staff nurses who are there in the clinical area. You want to do something, but your tutor expects you to do something as a procedure, and here the staff nurses will ask you to help with them with the day-to-day care. You're torn between the demands that is also takes place, does not allow you to practice what you have learned. And most of the time, the students also complain saying that from morning till evening, we just do basic care. At times, I tell my students, it's not that only cleaning is nurse's job. Sometimes it so happens till 10 o'clock, right from the morning, they do clean the inanimate objects, doing bed making, doing temperature checking. And after 10 o'clock, it's cleaning animate objects. Like they go about bath, PC, mouth care. Nursing is not about cleaning alone. It is much more than that. Okay, so many times students also say that they have been restricted from practicing many skills, but it is in our hands. If we find time, we can do. I just want to challenge each one of you. How many of you, first of all, own a step? Now, that means maybe first year you would have had, after it is worn out, you wouldn't have bought another one. The second thing, how many of you use your step regularly every day, not for checking blood pressure? Apart from checking blood pressure, the same step can be used to auscultate a patient's lung who's got respiratory problems. You can check, okay, you can check their adventitious sound. What is that? Is it a bronchi or is this a wheeze? Okay, the same step can be used to assess whether it's a diastolic murmur or a systolic murmur in heart sounds. The same step you can use on a post-operative patient to assess their bowel sounds. But what is that used for? Don't think step is an ornament. It is not like your neck piece or a earring that just has to be around the neck or on our ears. It is an equipment that needs to be used. If you don't use it, you will lose it. At one point of time, you will never even understand that it's part of your career. Okay, please use. Theory and practice has to be intertwined. Then only learning will take place. If learning takes place, only you can bear fruit. Otherwise, you will stand without leaves. Okay, as it's shown in the figure, It is part and parcel. It cannot be separated. Then only people will look up to you. They will learn from you. Today we are here. Tomorrow you are going to sit in our place. If you learn, if you practice, your skill is intact, you have sound knowledge, only you can be better teachers. So please fill the gap between theory and practice. Most important and the commonest one, even everybody goes through, even each one of us go through. Even today I am going to be supervised, I will have some amount of anxiety. Anxiety results because of feeling incompetent, especially, I know how it feels when first day they go to the clinical placements. They're totally lost. There are some students who cry. There are some students who go with full confidence because they don't know what is being expected out of them. But remember, what is the best place to learn? Nothing replaces that. Of course, you have certain amount of anxiety that is always present because of these things. What is that? When you know that anxiety increases, learning decreases. There are three major reasons for all of us to be anxious. Number one, you have fear of making mistakes. Don't worry, everybody makes mistakes and we learn out of it. But don't try to learn from your mistakes. Somebody's mistakes is our gain. Okay. Second two is initial clinical experiences on a unit. Maybe first day might be intimidating. It might be a bit scary, but you will do well. Third thing is performing clinical procedures, because haven't learned only in the classroom. Now you're going to learn, perform it on patient, causes some amount of anxiety. That is normal. Okay. Don't worry about it. Okay. And the next is student allocation. Sometimes too many students in one ward where there is less number of patients. Okay. And that does not allow you to learn much. This is also one of the barriers that we have in the clinical area. Confusion of identity. Okay. Many times you don't know what is being expected out of you. You go to the clinical area, sometimes you're not being oriented, or you don't know what is the clinical requirement that is there in the particular ward. You spend the 8 hours or 5 hours weighing, just doing the routines, just doing the things what you tend to do. Sometimes this becomes a barrier. So get to know what is that you are supposed to do. Emotional reaction, stress is the major one all of us go through. Okay. And many times students are stressed when they have to start a new IV line, or they want to give medication. There's one student who told, I kept praying after giving medication that patient has to be safe. Okay. So we need to be very careful. Okay. So stress is something that part of them does not allow you to perform to your fullest. Inferiority complex. Sometimes we feel so inferior compared to other disciplines. No, please understand, God has called you for a right purpose and a right place. When He has called you, He will equip you. He knows you are the best, and that's why He has chosen you for this profession. Only thing, we have to develop ourselves, okay, so that to do great things. And even the studies say students in the lower semesters experience greater inferiority compared to higher semesters. As you go high, third year and fourth year, your confidence increases. Motivation, very important one, but it's a very big barrier. If you don't have that interest, if you're not motivated, you are not serious about your studies, you just come like any other day, walk in and walk out. No, it's not going to help. Okay. Or you have personality conflicts or lack of interest. You have a circle, you are in a team, and that you're not happy with your team members, or the team members are not in harmony. Learning is very much affected. Okay, having seen all the challenges, now we move on how to address it. First of all, I want you all to be remembering one thing, that you are adult learners. You are responsible for getting educated. Okay, and it is an active process. You must learn to ask questions. One of the biggest problem with nursing students is they never ask questions. Okay, seek learning opportunities. That's something is very, very important. You are capable of making decisions. Make decision, actively participate in your learning. That is very much important. And remember, your prior knowledge and life experience sometimes can hinder. Last time I started a line, I made a big mistake. So this time that can make you to sink, but don't worry. Last time you made mistake. Now you learn from your mistake. You can do better. But whenever your experiences comes in front, one thing that you have to remind yourself is each patient is unique, and each patient is a different individual. Okay, even two patients with the same diagnosis, okay, appendicitis, might not behave the same way. That is what we learned in nursing process. Nursing diagnosis is something we treat patients' responses to actual and potential problems. So don't look at both the patient with the same diagnosis the same way. No, they'll be totally different in the way they might be presenting. So assess the individual separately. Make your plan perfect to your patient, custom made. How we make our salvas custom made, how we make certain things accustomed to our things, personalize it. Just like that, your assessment has to be custom made. How to learn? There are many ways to learn. Let me tell you, a lot of things are available. Informations are coming to us every day, but it depends how we are going to learn, what we are going to learn. Okay, many times, many informations are very credible and meaningful that will give you insight. At the same time, there are many things that is there on the web. It can be meaningless and misleading. So every time you take a content you're reading, whether it's authentic, is am I taking it from the right website? Today I want to post something or you want to post something, everything can be online. Even your data and my data is online. So please be careful about it. Okay, what you are doing, what you are learning plays a very, very major role. Do not take informations blindly from anywhere. Okay, that's very, very important. And remember, all of us are different types of learners. None of us learn the same way. I have some students who just read once, they come and get 80%, 90% marks. There are some students who have to read, write, take notes again and again. No, they keep on munching over it. Every time you can see them with papers here and there walking, then only they can perform well. I do have students who just say they listen to the essay, a friend read it, and then she just told the important points, with that they can write. So all of us are different type of learners. And remember, sometimes we might have to unlearn and relearn things. Be open-minded, be clear. Many a times we are so confined, okay, and we look at everybody the same way. It's not so. Each of us are very, very different. So how people learn? Okay, some people learn by their own because they have the want to learn, they have the earning desire to learn. That is motivation. Some people will learn by doing. Okay, they want to take a trial, they just want to take some step and try and see. That's okay if it becomes a mistake. Some of us even don't want to take any mistakes. We are very scared to make mistake. I do have friends who never want to try even a new dish. Okay, they even always ask somebody, no, is this good in this hotel, then I will order that. Or some people, they don't even ask feedback. They always wanted to do what they have been doing. They go with the regular ones. I don't want to take risk. It's not so, but individuals are different. So learning by doing, either by trial and error, sometimes feedback from others, sometimes you make sense of what you have learned. Okay, these are the 4 ways all of us learn, and these 4 processes are very important for all of us. One alone does not help. Motivation alone cannot stand alone. Okay, do you understand? To give the complete learning, you need to try, learn, and do. You need to get feedback from your friends, from your teachers, from your well-wishers, and whatever you learned, it should make sense for you. Try to relate with things. Okay, tend to ask questions, and only it makes sense for all of us. Okay, I just want you all to do one thing. Having listened so much, no, you will get bored. Here, you can open up your chat. I just want you to identify, do this work. There is a crosswords I have been given, word search. Basically, I have hidden 9 hormones inside this. Being second years and third years, would have been to med search, medical surgical areas. All the hormones are related. The clues are given down. There is a hormone that helps in BMR, regulates BP, regulates calcium. Okay, if you can identify, I'll be very happy. Once you identify, type everything together and send it in chat. I'll give you 1 minute time. Okay, I want all of you to partake. Then only you feel light. Otherwise, not going on listening to me will be so monotonous. Again, that will become a barrier. So open your chats. Okay, don't send one by one. If you, how many ever you could identify, keep typing and send together. Let's see how many of you are able to identify. There are 9 hormones hidden inside this word search. I just give you 1 minute time. Don't type one by one. Then I have to go through. Just type together. Put comma and type and send together at one stitch. There are 9 hormones. Let's see how many of you are able to get all 9. Try to put comma and do it. You people are sending it one by one. So let's see how many of you are able to get at least, yeah, Shalini Sharma has found 4. That's good. Akansha has found 3. Shreya has found 4. There are 9 in it. Come on, you can do it, people. Some amount of overlapping is also there. Yeah, 1 and 2. You can do it. It's all the hormones what you know, and the clues are there down. Yeah, fine, good. Ah, come on. Yeah, great. Yeah, Nancy has found 6. Himani has found 8. Yeah, that's nice. Okay, we'll stop here. 1 minute is over. I hope this at least pushed in some adrenaline into your brains. Okay, let's start moving. Good. Okay, the answers are coming in the next slides. Okay, you have testosterone, thyroxine, vasopressin, renin. I think nobody identified renin. Okay, insulin, calcitonin, hydrocortisone, and epinephrine. Thank you all. Good effort. Okay, once in a while we need to have break like this. Okay, thank you so much. Okay, I hope now you can concentrate better. Now, having seen all the hurdles, all the challenges, okay, how are you going to handle it? Okay, that is what we are going to see. It's going to be very simple. This is what you learned in your first year. Remember the tripod in nursing, without which you cannot go about doing anything great. Okay, tripod, 3 legs are very important. One leg is shaking, also you will topple. Okay, so you need a head which is completely knowledgeable. You need a heart to feel with your patient, and you need your hand. That means you should be skillful enough. Having known this is something called hypoglycemia, the patient is in hypoglycemia, but my skills are very bad to start an IV line to give 50% dextrose 50 ml. That is not going to help the patient. Or I know the knowledge, I do have in her hands, my skill is too good to start an IV line and give a patient or a straight IV push. But I think that my time is, duty time is over, now I have to leave. I don't have a heart to do it. Things are not going to be good. If you want to be a good nurse, you need to have good knowledge, that is your head. Keep updating your knowledge. One of the principles of scientific principles of your profession itself is you need to have a sound body of knowledge. Please update your knowledge, okay, time and again. Then only that can give you high performance. Update your skills, keep your skills intact, practice it whenever there is a possibility. Just because I finish physical examination first year does not mean that I will not do it in third year. Make it appropriate for this particular individual, for this particular patient. Okay, always have a heart to learn. Even today, I'm going to be 40 years old. Okay, I have been in the nursing profession for the past 18 years, but still every day we learn. Sometimes I learn from my students because something is new. I tell them I've never seen this before. What is this all about? They say, ma'am, this is a new glucometer. It's a new Nova pen. Okay, I learn them. I learn from them. There's nothing wrong. It is always good to learn. After all, learning is continuous. You need to learn. You need to update yourself. Get your skills intact. Okay, so all 3 H is very, very important when you want to overcome the challenges in your profession. Number 1, anxiety. I really want to address this. Okay, most of the time the reason is that we are anxious is because we don't know what is being expected out of us. First thing that you have to ask your MANS the moment you enter into the clinical area is, what is my objective? And if you know you're going to be posted in this particular ward, if it's going to be a medical ward, what is the requirement I have in this particular ward? Do I have to do a care note? Do I have to do a case study? What are the procedures I need to be gaining skills at? Which are the skill acquisition I should get at the end of this 1 week or 2 weeks time? Okay, what are the kind of assessment I should be completing? This is what you're supposed to be. Know what is needed. I wanted to share a testimony again here at this time. I had a student who's very good at her knowledge, but every time she comes to the clinical area, she will be literally shaking. Hands will be sweating. To that extent, even the charts will become wet when she starts to document. And we used to talk to her, tell her, spend some time. But when she was in second year or third year, I found that she was getting best in proficiency. That means clinical experience. I called and spoke to her. Very good. I'm so happy for you, because first year she used to be very tense. We used to keep calling her and saying, knowledge alone is not enough. You have to develop your confidence skill. And she said, ma'am, I start to pray. And second thing is that every day, half an hour, somehow I sit and study the procedures, what I should be doing every day. That gave me the confidence. So when I go to the clinical area, I know the steps and procedures. When my mom guides me, I'm able to apply it better. So I always tell you, this is my sincere prayer when I used to be in student period. Lord, I'm not going alone. Okay, nothing is going to happen we both cannot handle. We both is me and my God. Nothing is going to happen that we both cannot handle. I'm not going to put my head in shame or guilt. Until today, the Lord has led me so beautifully. So pray, plan, always prepare and proceed. I'm sure your anxiety will come down. Always stay close with your instructor or the teacher. So she will tell you what you are supposed to do. Your enthusiasm will be infectious. She will be able to teach you the best. Look into your entire rotation, plan for it. What is that I am supposed to finish end of this posting? Then you will never be anxious. What are the strategies to overcome challenges? Number one, practice critical thinking and clinical reasoning. I will just take you through it. Basically, you're going to ask why. Why I have to do this? If I don't do this, what will happen? That is what is why and why not. But somehow nursing students never ask questions. Okay, that has become the trend. Learn to ask questions and do reflective practice. Please reflect back. Okay, always it is nice. I will take you through how to do the reflection also. And please study to understand and apply, not to memorize. Always have the habit of comparing book picture versus patient picture. I had this habit in the student period. Every day I'm assigned for 3 students, 3 patients. I come back to the room. Okay, take 10 minutes to read the disease condition. That day, present, check what your patient had, what does the book says. Compare, always it stays fresh in your memory. I can tell you my first second year care note was on CA stomach. Okay, my second year essay was on CA stomach. I was able to get great marks in med search. It's just because you compared book picture with patient picture and you cared for the patient right from the time of admission till discharge. Nobody can be the better teacher. Your patients are the best teachers. You can learn from them so much. What you see in the book, you can just pick on them. You can even write in your pocket notebook and go, these are the book picture. And what is present in your patient, put a tick. That makes you to remember so very well. Okay, so always have the habit of comparing book picture versus patient picture. Critical thinking. What is this critical thinking is all about? Okay, it is not somebody says something, always check temperature and had 0.6 degrees Celsius or 6 degrees Celsius or 1 degree Fahrenheit. Means you should always ask a question. Why is it so? Okay, why is it we always have to hurt 30 millimeters of mercury from systolic by palpatory method and then check an auscultatory? Always ask questions. It's not about learning facts. Learn to ask questions. Study to understand and apply. That is very, very important in clinical thinking. If critical thinking is there, automatically clinical reasoning comes. Clinical reasoning is ability to reason out. Okay, what will I do next? What information do I need to decide? What is my what is that makes my decision pending? Okay, like many times people do tell in the layman's time, whether the chicken came from the egg or the egg came from the chicken. Okay, it is also a kind of reasoning. You're trying to find out, okay, what is first? What is that I have to do next? Okay, there is a process. I will just explain you the scenario, you'll understand better. Okay, it is a process. First, look at your patient. Collect information. Certain things patient will say, certain things you will pick up on a patient. You look at them. Okay, that's called as cues. The things that you get by your senses. It could be a smell. Okay, through a smell, the patient is smelling fruity odor. Okay, or the patient is having acetone smell on them or a uremic smell on them. Okay, sometimes you look at them. Okay, patient, you touch and see through your senses. Whatever you get, collect those information. Process this information. Put it in your mind. And what is that all is saying? Okay, identify the problems, put a goal. What is that? Take action and evaluate your outcomes and then reflect on it. Think back whether what I did is correct. Go back to the patient. This is only clinical reasoning. I'll explain this with the scenario. If you're on night duty, 4 a.m. in the morning, you're going to the patient's bedside to check temperature for a 56-year-old lady who was just come and admitted with a history of fever. Okay, you're about to check temperature. When you touch her hands are cold and clammy. She's not responding to calls. Pulse is very feeble and the respiration is very shallow. What is that your nursing intervention will be? Now, this is what I say, put all things together. This exactly happened for me when I was a third-year student. Okay, I was the one who was about to go check temperature for my patient. I went and checked, patient came with a history of fever. So 4 a.m. temperature, I went to check, patient's hand was cold and clammy, not responding. I called the patient by name, shook her to the core, but she was not getting up. Checking pulse, it was very feeble, hardly I could hear. Okay, breathing was so shallow. So immediately we thought the patient is arresting and we found the patient at the right time. All of us jumped on the patient, started CPR, started bagging the patient. 5 minutes, 6 minutes, we couldn't see any improvement. The cardiac monitor does not show anything very great. Patient was not responding. Suddenly, to my senior who was there beside me, was a staff nurse. She looked at me and she was saying, Angelin. And we called, by then we believed this second call, first call and all. And suddenly both of us came out with one idea, but patient was not a diabetic. Okay, but patient was starving for a procedure that day morning. Is it hypoglycemia? Immediately we both felt, brought the glucometer. I'm talking 20 years back, checked her GRBS. GRBS was 30 milligram per deciliter. We just gave 50% dextrose, 50 ml straight IV push. After 45 minutes, patient was sitting and having a biscuits and coffee. Okay, so sometimes we are helpless, we don't think. Okay, it comes by practice. Keep thinking, get the cues, put things together. Okay, we know patient is not diabetic, but patient was starving from previous night for a procedure the next day morning that she has to go through. Suddenly it got clicked for me, because within 5 to 6 minutes, usually these many repeated cycle of CPR, patient will do well, they respond, or at least no, there will be some amount of changes. Otherwise, if we wouldn't have identified, no, it just sparked for us. So this is what is clinical reasoning. Associate things, get extra information. You might have to think a bit. What is wrong? It is like a detective work, basically. What is wrong? What is right? What could have caused the problem? These questions you have to ask to yourself. And you have to think about the various options and choose the best option for your patient. You will do well. I charge you and I challenge you that you will do well. So clinical reasoning is something is very, very important. Always ask questions. Learners, please ask questions. Okay, if you want, just look at a book that's written by Brookfield. It has got critical thinking questions, very nice questions he has written. If you can happen to find in your library, find this book. And okay, and it is very important. You should ask this question: what would happen if I do this? Okay, what is there to know? How is this relevant? Why is this relevant? You have to keep asking questions. Don't be very blank. I just want to tell you one case scenario here also. I had my students were there in end of first years, and they were jobless. Okay, because they finished all their care and they finished their exams, and they didn't know, it was a miscellaneous posting for them. So they were loitering around. I went for rounds. I asked them what happened. They said, ma'am, we completed all our care. It's just that it's quite boring because it was 8 hours. So I said, did you do an assessment on your patient? They were like smiling at me. Then I said, come, let's have a quick nursing rounds around the bedside. And we went, and one of the patient had thyroidectomy, post-op patient was there. So as we are talking to the patient, what happened and what is the anatomy, everything we were talking, and suddenly asked a question to the student saying that, suppose, how do you know this patient is bleeding? Where do you check for bleeding? Some of the students says in the neck, ma'am, because the incision is there at the neck. Some of them told so many things. And after 6 to 7 minutes of talk, there's only one student who came up and told me the answer saying that, ma'am, you have to check at the back, nape of the neck. I said, excellent. Okay, that is the answer I want. And I asked her, why is that so? Okay, for a long time they were thinking, and one of the student came back and answer said, ma'am, I've seen in the movies, okay, you shoot the patient, only the blood spurts at the back. So that is why it is. I was taken aback. I was so alarmed. After being 1 year in the clinical area, you are not able to think. I said, these patients are in low Fowler's to semi-Fowler's. When they're lying down like this, naturally bleeding will get collected only at the nape of the neck. That is the reason for it. So every time ask question, make them to think, how is this relevant? Why is this relevant? Is there anything more that I have to learn? Okay. Always relate anatomy, physiology, whatever you learn in first year, relate it in second year. You learn all normal things in first year so that you can learn the abnormal things and correlate. Okay. So please ask questions. Reflective practice. This is something is very, very important. End of the day, or once you come out of the clinical area or within the clinical area, end of the hour, what is that I learned? Sit together, think aloud. Then only it can have a deeper understanding. Or sometimes as friends, you might have to sit together or along with your teacher. This basically you are going to ask few questions which will make you gain a deeper understanding of what you did. Why did you do that? What you shouldn't have done at that particular point of time. Think aloud or write in your diary. Okay, that's a best practice. Okay, reflective practice. What are the questions? Choose one treatment. Okay, the patient is receiving, and check in the literature. Suppose this patient is getting what kind of a sulfonylurea. Diabetic mellitus means, okay, this patient is getting sulfonylurea. What does the book says? Okay, that is how you have to compare. Okay, what is the most important thing that I learned today? Learn to ask questions. Always ask why this is the treatment. Why is that? Then we get to know. Okay, I still remember when I was a third year student, a patient was getting second generation cephalosporin. All of a sudden, they changed to third generation cephalosporin. I asked, what is that all of a sudden you're changing? They said, because it is bacterial meningitis, only third generation cephalosporin will cross the blood-brain barrier. And that is why we have put a new antibiotic to the patient. You have to ask questions, otherwise you will never learn. Okay, what feeling did I experience today that influenced me to the care? I cared for my patient. Ask, how do you feel end of the day? You're feeling challenged or feel good about it? Okay, did it improve your confidence? Okay, in what way I was accountable for my patient care? All those things, that questions that you have to ask. Ask these questions and keep writing. Okay, this will help you to go about. Reflective practice is very, very important. This will tell you your weaknesses, what you are running from, what is that you're boldly doing. Okay, you will be able to develop yourself. Okay, either sit together as a class and do it, or sit together as ward mates and do it, or sit with your teacher and do it. Okay, it's something is very, very important. Okay, it's very important to a personal reflection. That is something basically tells you how to improve. What is the decision I made, okay, today? Okay, well, how do I determine the priorities? Anyway, I made a wrong priority. How do I do it differently in the future? That is something which is very, very interesting. And I want to highlight at this point of time, being all baccalaureate nurses, most of you, okay, there are 3 roles all of you have. This has been given by American Nurses Association, American College of Nursing, okay, together associations. They said 3 basic roles for all baccalaureate nurse, and 2 you all know what you have it in red. You are a provider of direct, indirect care. Number 2, you are a member of a profession. All of you know it. The most important one that I would like to emphasize is you are a designer, you are a manager, you are a coordinator of care. You might wonder how it is. This is how. I give an example. Okay, remember you are a caregiver, but at the same time you are the manager and you are the one who coordinates your patient care. If you have a physiotherapist coming to your student, coming to your patient to give a chest physiotherapy, you know if you have given feeds for the patient right then, that is the moment you should say, patient has been fed right now. After 1 hour, we can give a chest physiotherapy, otherwise patient will aspirate. A patient is sleeping after a dressing, painful. Okay, patient is resting. You can always tell them to come later. Or a surgeon wants to do a dressing for the surgical dressing. You have to recommend, you have to advocate for the patient to have an analgesic before the dressing starts because it's going to be painful. So you are the most important member and manager and coordinator of your patient care. You need to use your all 3 H. Then you can plan your care. You can go, okay, and do great things, great wonders in your patient care. Love what you do because you are called to do the best, and only you can do the best for your patient. That is why you have been appointed at that particular point of place. So always remember, you are a person who are the spokesman for your patient. Okay, if you know the best, the quality of care will be very good. So please understand, you are the manager and coordinator. I just want to tell a few tips and then want to finish it. Please learn to understand, recognize a relationship and learn. This is my personal thing. Practice makes everybody perfect. Okay, have mock drills, have simulation, have mentors. Sometimes it can be your teachers, sometimes some staff nurses, sometimes your seniors. They will lead you the way. Okay, when your teacher is not there, ask questions. Always ask questions to your friends, to your teachers. Why is that like this? Why, what, how, when, where, why not? They are all your best friends. You ask these questions, you will do it extremely well. And learn always. Make it a point to teach your patient every day. When you learn to teach your patient, you tend to learn. Okay, and the patient, your image will get lifted up. Okay, do you understand? I have got many experiences. There are patients who used to be very troublesome, or patients who doesn't seem to respect nurses. You go back to during a break time, read a good topic for them, come back and give a good health teaching for them. After that, the attitude they have towards you will totally change. They will cooperate with you. Okay, I have experienced that. Every time I have a tough patient, okay, go back, read something very good, relevant to the patient, come back and give them the best teaching that you can give. After that, the way they call you will be different. They look at you will be different. They will start to look for you. Okay, reflect every day. Do not strain, but train the brain. You start first 2 or 3 times, it might be difficult. Once you start to ask these questions to you, your brain will automatically start to ask these questions, even when you are not thinking. Always be ready to learn. In every day, make it a point to compare the book picture versus patient picture. You will not forget that in the rest of your lifetime. Exploit your teacher. Being a teacher, I always tell my students, get the best out of your teachers. You need to get them out, because when you have the passion, the teacher will tend to do the best. They want to see the enthusiasm in you. Exploit your teachers, okay? Then they will teach you whatever they know, they will teach you to the fullest. Learn new skills. Make it a habit to learn new skills every day, not the monotonous ones. Okay, and pray, plan, prepare, and proceed. God will lead you through. And look at the larger picture. What is that I'm going to be? Lift your image. You are the image. Nobody will say, no, the second year student made a mistake, or third year student made a mistake. They say the nurse. If you're going to be too good, they're going to say the nurse is good. Nurses in this institution is good. You're going to lift the image of nurses. If you practice all these things, you impossible will become possible. You will be able to overcome all the challenges that you have in your clinical area. And I know as teachers, they will be very, very happy. Okay, you will be able to take risk. Okay, and the teachers will be able to give good. Okay, so great teachers, they exude passion as well as purpose. And if your teacher asks it, for sure you will get it. Only thing, develop a good relationship between your teacher and yourself. Respect them. Automatically, they will start to give you the very best. Okay, remember they are seniors. They know better than you. Learn from them. Anytime you can learn, continue to learn. There is no limit for learning. This is what I would like to say. As it told, challenges are what makes life interesting, and overcoming them is what makes meaningful. Make the best use of it. Every challenge that comes in front of you takes to the next step. Okay, I stop here. Okay, if you have any questions, you can ask, we can discuss. Otherwise, nothing from my side. I hope I have, if you have any queries, we can go about doing it. I hope I made myself clear. To some extent, I was able to help your challenges to come to an end.
Okay, thank you so much, ma'am, for this wonderful session. Really, I would say it was a great mixture of theory and clinical expertise of yours, which has been exemplary shown with the help of the case scenarios which you have discussed actually. And really, I felt very light because it was not at all theoretical. And really, I would say the participants would have enjoyed the same. One query was here actually. Ki, you can find in the chat box, ma'am. How one can improve the critical thinking when everyone is devoid of clinicals now because of this COVID-19.
Yeah, COVID-19, yeah, that is not a hindrance for all of us. Like, no, you just have to, like, your teachers can help you basically. You might have to set some few case scenarios, or you might have to think certain areas. Like, example, suppose you're going to read on diabetes mellitus, or you're going to read on CA stomach. All you have to ask is, if this is a patient who's presenting like this, what are the care that I'm going to give? What is that? You will list down. Basically, you have to apply your nursing process. Your nursing process actually enhances your critical thinking, because you're going to do an in-depth assessment, following which you're going to pick up a right nursing diagnosis. You will be able to choose the best expected outcomes. Okay, do you understand? When you choose that, you will say, what is the priority? This is a priority for my patient? Okay, if I am a patient, what is that will be most important for me? Like somebody who's not even able to breathe, the patient has not eaten for 3 days. 3 days not eating is not the priority here, because I'm not able to eat. Even you keep my pizza, my favorite, your pizza is favorite, or for the South Indian, biryani is their favorite. We don't feel like eating because I don't feel like breathing. So breathing becomes my priority. It's all based on your nursing process. If you want to be a good nurse, you want to get your critical thinking to get fired, plan a perfect nursing process. You yourself can frame a scenario. These are the patient complaints. Put everything in order. List what is the high priority, low priority. Select appropriate interventions. Interventions has to be what is independent. not always assessing, encouraging. It is what you can do it for your patients. That is very, very important. I still want to tell you one time when we went, we were asking history for a patient, and that's about a CA stomach. I was going and collecting, and few questions we asked along with the student. Do you have the habit of eating smoked foods? Do you have the habit of this? Is that you feel satiety after you take small amount of it? End of it, patient said, you are telling every complaint of mine. How do you know what I was going through? It's basically the book picture you're trying to apply it on your patients. Critical thinking is only by applying nursing process. If you are able to create a better nursing process, I'm sure you can do great things for your patients. Okay, prioritizing, choosing the best interventions, apply it. If not applying, you will come back. Where is the problem? Where I went wrong? Okay, you might plan for a cold compress for your patient or a cold application for your patient. Suddenly patient develops chills. Immediately, okay, what I should be doing? So your critical thinking makes you to think, plan A is this. If this is not possible, plan B is ready in my hand. That is all it is. It's very simple. You will enhance it. Do a nursing process. You will be a good critical thinker. And again, learn to ask questions. Never, whatever teacher says does not mean, yes, ma'am will be correct. It's not so. Learn to ask questions. Why is that so, ma'am? Then you will get the answer out of their mouth. Out of their experience, they will be able to. If not, both of us will learn together. It's very simple. As teachers, even we learn today. There are times our students ask us questions that make us to think. Okay, that's something very nice. Learn together. After all, we are all learning. Okay, we are there in the learning process.
Okay, thank you so much, ma'am. So I think so you have given answer for the next question also, that is how critical thinking can be initiated while working in clinical area or the clinical setup. So this is the same.
I want to give you, I have one teacher who helped me in second year. Like 2 patients underwent appendicectomy. One patient went through open appendicectomy. Another one went to laparoscopic. Just make these two students to present their care. Okay, this patient had 5 days to recover. This patient second day recovered. The problems for this patient is totally different. The problem for this patient is totally different. Always compare and contrast and learn. That is something which will help you so much. I also want to share at this point of time, one of my classmates who took care of a CA breast patient, and afterwards she is written and put in the classroom because she presented her patient. And in that, the most important nursing diagnosis she gave was body image disturbance, low self-esteem. And I want to tell you, the most senior, most surgeon came into the ward for rounds on that day, and they were using the classroom. End of it, he called somebody and said, "Who's that who used a blackboard?" And we all got very, actually, a bit jittery, thinking that we didn't erase it, and so he goes mad because he want to use it. Then one my classmate went out and said, "Sorry, sir, it's me only. I forgot to clean the board." He said, "No, I want you to take class for my surgeons. We operate and we leave the patient, but we never look at this angle." Okay, that really boosted up our energy. Okay, do you understand? Like my classmate went and took class for surgeons, you believe it or not, and she said, this is what the patient is going through. It matters. There are many times people look only at that particular organ, but you are the one who's going to give a holistic care for your patient. You know the very best. You meet all their needs. So never feel bad. Learn to do things for your patient. Do your fullest. You will be recognized. If you are the best nurse, your patients will recognize you. People around you will recognize. Okay, if they don't recognize, also doesn't matter. You have the inner peace that you have done the very best for your patients. And one day, for sure, in him there is no darkness. Things will come to light.
Okay, thank you, ma'am. We have one more question in the chat box. Is learning from case scenario much good or learning from life experiences? Also, nursing students are often given only the basic things to do. So
No.
how can we overcome these situations?
Yeah, both has got importance. Right now we are there in COVID. Most of the students are not able to go to the clinical area. We give them case scenarios, but case scenarios comes out of an experience of a teacher. Nobody writes a case scenario just like that. We don't cook up. Case scenarios are basically based on patient picture, but it is in the hands of the teacher who gives life to it. You want to give, like, no, at a stretch you can give all the data, or as a student keeps asking you questions, you can keep giving data that will enable them to think. Like I might give only few things, few assessment, few subjective, few objective data, and ask the student to think. Then the student can keep asking you questions. You can keep giving. How much they ask you, that much you can keep giving questions. So case scenario is good, but when you go to the patient's bedside, Nothing replaces your hands-on experience. But when you prepare yourself with a case scenario, your mind is tuned. Your eyes cannot see what your mind doesn't know. Okay, so learn to do it, practice it in your mind. What is the question I'm going to ask? How is it going to be beneficial for my patient? Instead of asking 10 questions, how can I ask one question, put forth one question and get all the answers from the patient? That is what matters. So I would say best case scenarios are good, okay, to develop your skills, to develop your confidence here, but nobody can replace your patients. Your patients are the best source, and please learn from them. And because no, I don't think when we become patients, whether we'll allow anyone to learn from us, but there are patients who are willing. Okay, you do your best. They feel very comfortable. Sometimes my first year students walk so confidently in the ward, they will never believe they are first years. Sometimes my first year students will be crying in the bedside. They will say, that sister I don't want. That has also happened. So it is in our hands. You have to boost yourself up.
Okay, ma'am. Thank you so much. Next question is like, how can we motivate BSc nursing students for critical thinking when patient-student ratio is like 1:8 or 1:6, etc.?
This is again, that is what I'm telling. Basically, nursing rounds will help you. Like having that one student who cared for the patient, that patient, you can take all the students into the classroom, put them all together, let this student start to present. When she presents, maybe you can present up to personal, present medical history, a past medical history, stop it. Now allow everyone to do pick up the subjective and objective data from it. Okay, ask them to ask these questions, write down few questions along the side. Okay, it's basically a nursing round. Either you can do it at the bedside on the patient, or you take them to the classroom. It's a teacher's hand. Okay, so the teacher has to now give the scenario. Now this student will present, end of it they will have a discussion. Now each one of us will gain the confidence of taking care of that patient. So 1:8, 1:2 does not matter. All it matters is how the knowledge is being disseminated. And when something is very crucial that you want them to learn, you might have to take them as 2 or 3s and make them to, suppose there is a thrill, you want them to feel the thrill, then you might have to take to the bedside, tell the patient, just my students would like to lay their hands on your chest to feel the thrill. That's all it is. Okay, it's a matter. But otherwise, other critical thinking can be enhanced in the bedside itself as a rounds or in the classroom. We have CPs, no clinical presentation. Through that, we can enable. That will help the students to gain a better knowledge.
Yeah, it's true, ma'am. One query is like, is it necessary that patient recognize nurses because it is a profession that does not allow you to make personal recognition with the patient?
Personal recognition, I did not mean that we have to give all our details, demographic details. Here, what I mean is sometimes my patients call me and ask, why is it that sister is not here today? Okay, that makes me very happy because they recognize. Sometimes 2 days, 3 days, we don't go to the clinical area. Next day they see me, sister, I was looking for you. That is what I mean is personal recognition. They will sometimes ask, I want this sister to care for me. I want this sister to pray for me before I go for surgery. That is what I meant the clinical recognition is. It's not about giving her all information. Okay, that is not the one. What I mean is you are being recognized means your presence and your absence is being recognized by the patient. Patient feels that your presence is not there. That is what I meant. Anything else? Stuck on the other side. Can you hear me? Okay, I see a question saying that how can we accept nursing profession as best profession? Of course, you're there in the best profession. Okay, 1998 when I joined nursing, I never wanted to be a nurse. After making my first bed making, I called home and I said, "You are here, or I will be there." Okay, that is what. It took 7 years for me to understand this is the best profession. Okay, because after I became a nurse, I became a tutor. I was taking care of my students, and I was about to quit nursing. I wanted to continue my other degrees. I did my MBA. I wanted to move out. You won't believe the day I was about to give my resignation. I just went to my pigeonhole, picked up, looked for some letters because I have applied for elsewhere else for job. I had 27 to 28 greeting cards saying my students have given me, you are the best teacher. And there was one picture which I cannot forget, like there was completely raining and two hands comes out and picks up a dog inside. You made a big difference in my life. Okay, so that made me to change my angle and I thought I should remain in nursing. So I tell you, doesn't matter whether others recognize you or not. Bloom where you're planted. God has a great purpose for you. There are many a times, okay, I do teach for medical students once in a while or 4 or 5 hours per in a year. They come back and say nobody teaches as nurses because you look into the every details of it and only you can understand. And many skills they learn from us and go out happily. And I'm telling you, unless you realize you're there in the best profession, unless you are convinced that you are in a best profession, no one can convince you. And I tell you, there is a day your students or your patients will recognize you are the best. And that day you will realize. It took 7 years for me to accept that I'm a nurse. So it is not possible for you to accept in second year or third year. It will take time. But be proud that you are a nurse and God has placed you in that place. And remember that no one can do the work that you have to do for your patients. That I can tell you very clearly.
Okay, thank you so much, ma'am, for beautifully clearing all the queries.
Can't hear you. We can't hear you, Dr. Mrs. Seta.
Is it audible now, ma'am?
No, very low. Couldn't hear much.
Actually, there are some technical errors over here. That's why I think so. There's a problem. आ रही है मेरी आवाज? Hello, is it audible, ma'am?
Yeah, but it's very feeble. Let me plug in and see. Okay, let's see. Yeah.
Okay.
Yeah.
Saying, a big thank you, ma'am, for today's session. And you have beautifully cleared each and every query exactly, and raising the standard of nursing and also motivating them to become good nurses. Thank you so much, ma'am.
Thank you so much. We look forward to do great sessions for all of you. But one thing I have to tell you all is, never let go of the passion that you have for your profession. And if you stay strong in the Lord and God can do great things, dream high, soar high, for sky is the limit and no one can stop you, okay? And only one thing I can tell you is you be the difference what you want others to be. If you don't have a role model, you step in, you be the role model for others. Don't care what the world thinks. Okay, so I just want to tell you, dream, desire, okay, and then everything will be done. Pass what you have in your head to your heart to your hands, and you be the best nurse. Okay, all the very best. We're so happy for each and every one of you. It was a session even to re-energize myself, okay, because we lack students and we take only online classes. Sometimes this interaction is not there. So all the very best for all of you. I'm sure after 10 years, though we all step down, you will be there in great places, taking the image of nursing across the world. All the very best. Our prayers are there with you. Dream high, desire to be the best nurse, and you will do it. It will take you to greater heights. Thank you.
Thank you, ma'am. Thank you for the blessings, ma'am. So once again, I'm very much thankful for your presence and for sharing your expertise with us. And here we conclude our first day session. I hope the participants have enjoyed fully the learning with such great experts, theoretical as well as with the clinical expertise. We know clinical learning is done by doing, but at least we can try our best in this situation. So the learning process should not stop. And for this, we'll be meeting again tomorrow at 3 p.m. So tomorrow's timing is 3 p.m. for the clinical webinar, and the ID password would be same. Let's learn and grow together.
Yeah.
Thank you, Angeline ma'am.
Thank you, Shweta.
participants.
Thank you so much for this opportunity. I thank you and Aradhana ma'am for this, because it was a reliving experience. I enjoyed. I went back to my student period to recollect certain things. Every day, each day is a learning experience. And thank you so much for this. I thank you all for it.
You're most welcome, ma'am. Thank you, ma'am. We are ending up this session.
Yeah, thank you.
Okay, ma'am.